Welcome back to another episode of Black Health, everybody. I am your host, Dr. Michelle Kirwan Bythwood, and I'm here to tell you that your wellness is not optional, it's generational. Today, we're diving into an issue that doesn't get enough attention, despite the fact that it is the leading cause of death in women in the United States. And Black women are particularly at risk. We're talking about heart disease in women. But too often, we don't recognize the signs. We get dismissed. We are unaware of how stress or lifestyle or even something like pregnancy can affect our hearts. Today, we are talking about heart disease in women with somebody who doesn't just know the statistics, she's out there changing them. Dr. Heather Johnson. She's an interventional cardiologist at Lynn Women's Health and Wellness, and she is joining us today to break it all down. Welcome to the show, Dr. Johnson.
Thank you so much. I greatly appreciate this opportunity.
Absolutely. We're happy to have you on Black Health. So tell us what you do and why you do it.
Well, thank you so much. I appreciate it. So actually, I am a preventive cardiologist. I'm the director of preventive cardiology for women's services at the Christine E. Lynn Women's Health and Wellness Institute of Baptist Health, South Florida, here in Boca Raton. And it's truly been a pleasure. We've had an outstanding program here for the past 5 years, dedicated not just as far as the clinical care here within the walls, but also community education and community health.
What types of heart disease do you treat? What do you see
Everything.
on a regular basis?
So it's a great question. So our focus is twofold. Number one, we treat all heart disease, but we really focus on what we call preventive cardiology, in which it means it's helping someone prevent either their first heart attack, their first stroke, preventing the development of heart failure, or also down the road, how do we address risk factors that contributed to disease developing? We also work with family members. We talk about screening of family members, and we look at risk factors that may run in families. We also work a lot with women who may have had prior pregnancy issues. So for example, high blood pressure in pregnancy, diabetes in pregnancy, because that can also increase risk of cardiovascular disease. And there's a very unique program here at the Lynn Women's Institute where we also focus on mammograms in women. And related to the heart, it has to do with breast artery calcification. We can dive into all of this, so I look forward to it.
I love it. Love it. So we hear that heart disease is the number one killer in women. Why does that message still kind of feel like background noise for so many people? Why is it still thought of as a man's disease?
So unfortunately, you're correct. Heart disease remains the number one cause of death in both women and men. And unfortunately, the numbers aren't shifting too quickly. In fact, they've headed in the opposite direction from what we want to see. Specifically in women, we've lost some ground. If we look back some years ago and we surveyed women in the United States across race and ethnicities, we were gaining ground in which they were realizing not just heart disease was number one, but what some of the symptoms are. Cancer is very important, and we work a lot as far as with a lot of cancer survivors and those going through cancer treatment. But even with our cancer population, heart disease is still the number one cause of death. So now we're focused on re-educating women that although cancer is important, it's not cancer, it is heart disease. And we talk about different ways that women may be at risk.
Why are Black women at higher risk for heart disease?
So when we look across race and ethnicities, unfortunately, yes, Black women or women of African descent can definitely be at higher risk for some key, what we call risk factors or contributors. So for example, higher risk of high blood pressure or hypertension, higher risk of diabetes too. It's not just the rates of these conditions, but it also has to do with the fact the impact of these conditions. So earlier development of high blood pressure, earlier development of diabetes, and then the impact within the Black community is such that it has a greater adverse event or greater negative effects on our arteries and our heart health. So when we think about heart disease, high blood pressure, diabetes, increased risk of heart attacks, increased risk of stroke, and increased risk of heart failure.
Let's talk about just blood pressure. How does high blood pressure affect the heart? Give us a little bit of a background on that? I think people think, I have high blood pressure and it's just a word and they know it affects their heart, but how does it affect the heart? Why is this a bad thing for us?
Great. So high blood pressure, I always say, can be very sneaky because you're correct. Over time, we have our top and our bottom numbers, and both of them matter, and they
Mhm.
may climb. One or both can climb over time. And what I've noticed is that number one, routine just access to care. Maybe someone hasn't had their blood pressure checked in a while, or maybe they're constantly in clinic, but other things are being addressed. But I've also seen where people have said, oh, your blood pressure's high, eat better, and not really moved on to the next step. The issue with high blood pressure is that pressure, every time the heart beats, is pushing against the walls of the artery. It's pushing as far as when we talk about what's necessary for the heart muscle to push that blood through. So I always say that each time the heart is beating, our arteries are responsible for taking the impact of that pressure. The higher the pressure, the more damage to our arteries. In general, we don't usually feel it, but at times, yes, people can begin to have headaches and vision changes because remember, our brain also has arteries too. We also talk about shortness of breath. So unfortunately, sometimes high blood pressure has been around for years that by the time we're detecting it, there's already some changes to the heart muscle and people can become symptomatic. Sometimes in the Black community, shortness of breath can be confused for asthma, where in fact it's the impact of high blood pressure on the heart when we're exerting ourselves.
It's very important to point out. So talk to somebody who's watching now, because I've experienced this even in my own family. One of my siblings has some high blood pressure and just did not want to be put on blood pressure medication. Why? Why is that important? A lot, and I hear a lot of adults say, "Well, I don't want to go to the doctor. I don't need to know my numbers. I'm not taking that medication anyway." And aside from that, is this something that once you take high blood pressure medication that you're on for the rest of your life necessarily?
No, so it's a really, really important point. When we meet during our initial clinic visit, first of all, our discussion is what are your risk factors for heart attack, stroke, and heart failure? As I chat with people, I say it's not just about the number. It's how do we protect your quality of life? How do we make sure you can get out and do what you want to do? And we're reducing your risk of these, what we call adverse events, these dangerous events. Many times I highlight the fact that there are two important pathways. When our body has high blood pressure, some of it is lifestyle. And yes, how we live our lifestyle and changes we can make can go a long way. Also, some of it is genetics. The way our body is just naturally producing and certain chemicals and the way the arteries are functioning that also contribute to high blood pressure. So when we talk about medication, I always say it's not either or. The lifestyle component is absolutely critical. But at times, we also need to add medication to address certain genetic components and all the different pathways that are contributing to high blood pressure, or if we're talking about cholesterol and diabetes. The other thing is that we want to make sure that when we're adding a medication, we explain that our whole goal is to lower the risk of stroke, lower the risk of a heart attack. And that hopefully with lifestyle, I always say, hopefully fewer medications and lower doses. When we talk about lifelong medications, yes, unfortunately, there are some times in which we have to keep medications on board. However, our medication options continue to change, and we're noticing that we're doing better as far as how effective the medications are. The other thing is that when there's room for lifestyle, I celebrate when we can decrease a dose or sometimes even remove a medication. And at the same time, understanding that consistency with both medication and lifestyle is absolutely critical.
It's the key. It's the key. What are some of the quiet signs or the warning signs that a woman's heart might be in trouble? And how does a heart attack show up differently in women than men?
So great. So I'm going to tackle both of these topics here. So when we talk about symptoms or warning signs, still I call it chest discomfort, chest symptoms can still be one of the number one symptoms. Although we talk about other symptoms in women I'll get to, let's not ignore it. Sometimes women may say, oh, it's just my heartburn, or it's on the right side. It doesn't matter, right or left side, up or down, whatever other condition is, we still have to listen to that. In addition, women are more likely to present with some non-specific symptoms. When we talk about as far as nausea, fatigue, also when we talk about the fact that sometimes there can just be, undue what we call sweating or diaphoresis or things when we talk about sort of just basic activities. Maybe the energy level is down on things that you used to do all the time. Even some of my very active, patients, we talk about, well, maybe you're not having symptoms like chest discomfort or shortness of breath, but how's your endurance? How are you recovering? Has that changed? And so we talk about really listening to our body warning signs. We can still have jaw, neck discomfort, back, arm pain. So I always say what's different and what's new, and listen to those signs. They become nagging. They don't go away. They begin to present earlier with different activities. And so also if symptoms wake you up, I've had people wake up and they start to pace and they try and go back to sleep. No, that's a time to call 911. So that's very, very important as far as listening to your body. When a woman presents with a heart attack, however, what we are learning is that it does vary.
We do need to take a quick commercial break. You are watching Black Health. We're talking about heart disease in women. Don't go anywhere because this episode can save a life. We'll be right back.
Get ready to groove at this year's Juneteenth Juke Joint on June 7th at 7:30 p.m. Enjoy live music by the W's, beats by DJ Cardi, visual art, and more. Get your tickets now at archcenter.org.
Filled with dreams, talent, love. At the Children's Trust, we are dedicated to nurturing the potential of every child and family with hundreds of trust-funded programs. Find a program at thechildrenstrust.org.
Great seeing you all. We need to do this more often.
Will you be paying separately or together?
Oh, you can put it together.
No, give me a second.
Hold up, I got this. I'll get the reward points.
Well, I have early pay, so this time it's on me.
My AI insights say that I have room in my budget, so I'll pay.
Well, I got all that and more with the One Love card from One United Bank.
Wait, the One Love card?
Yes, with the One Love Visa debit card, I got a full suite of digital services from the nation's largest Black-owned bank.
Well, how do I get one?
It's easy. Just go to oneunited.com.
Okay. Kristen's got the One Love card and the check.
When it comes to banking, One United Bank is where I want to be.
Welcome back. You're watching Black Health. We are here with preventive cardiologist, Dr. Heather Johnson, and we're talking about heart disease. Dr. Johnson, you were just about to talk about heart attack, myocardial infarction signs in women. Go ahead and break that down for us.
Yes, definitely. So when we talk about heart attack or myocardial infarction in women, how we present can be very different. And this is the importance of when we talk about our prevention therapy. You and I were talking about both lifestyle and medication. For women, even a little bit of plaque can cause a disruption in flow. So when we talk about a heart attack, it's a disruption in flow that begins to damage our heart muscle. The various symptoms that we have is relationship to our heart muscle being damaged and injury to the heart that's there. Our EKG, when they put the stickers on our chest and take a look, it may look a little bit different. Maybe sometimes the entire artery is not even completely closed, but a little bit of plaque can make a difference. Also, our arteries are more likely to spasm. As I tell people, they just get irritated and they tighten. And that can also lead to injury or heart attack symptoms or signs. And so that's where you and I were talking about some medications to help, because sometimes it just protects the arteries regarding heart attacks. The other thing too is that we want to make sure that as women, we present early. Yes, I know we're busy and the symptoms come and we're hoping it's something else, but listen to your body, immediately get to the emergency room, call 911, because time is important. I always say advocate for yourself. making sure that you describe the symptoms, you're concerned about having a heart attack. Make sure an EKG is done right away and that it's even repeated, because sometimes it can change within a few minutes or within the hour. Also, we talk about them checking what's called a troponin. It's a special lab that looks and tells the physician if you're having injury to the heart at that moment. And even if you're still having symptoms and maybe those labs are coming back okay, sometimes they do a special CAT scan of the heart arteries, because they can be surprised and say, wow, she really does have some heart plaque or heart disease. What's important, though, is that with the heart attack, as far as making sure the right medications are given to both women and men. Sometimes women don't receive the important medications that are needed. We can still be undertreated. Sometimes women are discharged with a diagnosis of anxiety, where in fact it's actually their heart. If it's found out that you do indeed have a heart attack, and whether or not they have to, quote, fix an artery or not, that's up to the physician. But it's very important that after discharge, if they said you had a heart attack, that you also participate in what's called cardiac rehabilitation, cardiac rehab for short. The reason why is that these small steps, the right medication, cardiac rehab, helps to prevent another heart attack. It actually even reduces your risk of death after a heart attack. I know we're busy. I know sometimes we say, oh, I feel good, I'm back out doing my activities. But that cardiac rehab activity allows them to monitor you and make sure the heart is safe, looks at your blood pressure, your heart rate, your EKG, and other data to make sure the heart is strong and make sure nothing else needs to take place. So there are a lot of different factors that play a role as far as heart attacks in women, how we present, treatment, and important follow-up.
Thank you for that, Dr. Johnson. And one thing I want to touch on is, how you said not to ignore the symptoms. I'm embarrassed to admit this, but one day I was at work and, I have high stress job. And I started having a little bit of chest pain, just a little, and I had never had chest pain before. And, I'm in the middle of my day. I have meetings, I have patients, I have staff that are looking to me to answer questions. And I'm like, oh, I have this little chest pain. And I'm like, okay, it's probably nothing. And I did the same thing that a lot of women do. I said, it's probably nothing. Finally, I called a friend of mine who is a pediatric cardiologist. And I said, I'm having this chest pain. He's like, go to the ER. Why are you calling me? And I'm like, but I don't think it's anything. I'm not having a heart attack. Well, I am old enough, I guess, to have a heart attack. I mean, I guess there's no age, right? So I actually, and this is ridiculous, I drove to his office which is way down south, and he did an EKG for me during lunch and it said it's okay. And that is an example of the worst thing to do. And I, as a physician who knows better, I still did that, so folks that are watching, that is not what you do. You go to the ER, as Dr. Johnson said. But I just wanted to say that because it is very real that you sit and say, I can't be having a heart attack. Like, that's not going to happen to me. But yes, it can happen to any one of us. So Dr. Johnson, you talked about your number, your blood pressure number, the systolic, the diastolic. What are some other numbers that we need to know, that are important to know in terms of our heart health? And maybe what are some of the tests that we should be getting done, if any, on a regular basis, or just as a screening, or just recommended when we're having health issues?
No, that's all great questions. And thank you for sharing your story. We always say we have to do the right thing too, where it's tough for us to be patient at times also. Mm-hmm. The other thing I just want to highlight as we talk about the numbers is that the numbers are important for everybody, because we're seeing actually higher rates of different types of heart attack, even when we talk about younger age groups. So for everyone, we started with blood pressure, not just knowing your blood pressure when you walk into clinic, but sometimes check it at home, check it after work. You'll be surprised. Sometimes it's higher during these high stress days. And we say higher in general, is it over 130? Is the bottom number over 80? That's very important. Keep an eye on it. The second thing is starting with a basic cholesterol panel. I often say the importance of an annual physicals. Many times people say, oh, I don't need a primary care team. I don't need a primary care clinician. But those annual physicals are actually very precious, because you get a head to toe on a lot of different labs. And with the right insurance and things like that, a lot of times we talk about the fact of access to care, and that's important, making sure that however, from community health screenings, et cetera, that your cholesterol is able to be checked. The other thing is that we talk about the importance of not just knowing your blood sugar, but what's called a hemoglobin A1C. And that helps for us to screen for diabetes. That's absolutely key. And many times our blood sugar can gradually inch up. And sometimes people may not have access to constantly have this checked. I have a lot of people come and say, Dr. Johnson, I just had insurance that'll start covering this. So I always talk about the importance sometimes of community centers that can be very helpful as far as in checking it too. Sometimes there are health fairs that are available in knowing these numbers and can also help to set up resources because access limitation is still very, very key and insurance is key.
Right, Black Health. You are watching Black Health. We will be right back after this commercial break.
Get ready to groove at this year's Juneteenth Juke Joint on June 7th at 7:30 p.m. Enjoy live music by the W's, beats by DJ Cardi, visual art, and more. Get your tickets now at archcenter.org.
Filled with dreams, talent, love. At the Children's Trust, we are dedicated to nurturing the potential of every child and family with hundreds of trust-funded programs. Find a program at thechildrenstrust.org.
Great seeing you all. We need to do this more often.
Will you be paying separately or together?
Oh, you can put it together.
No, give me a second.
Hold up, I got this. I'll get the reward points.
Well, I have early pay, so this time it's on me.
My AI insights say that I have room in my budget, so I'll pay.
Well, I got all that and more with the One Love card from One United Bank.
Wait, the One Love card?
Yes, with the One Love Visa debit card, I got a full suite of digital services from the nation's largest Black-owned bank.
Well, how do I get one?
It's easy. Just go to oneunited.com.
Okay. Kristen's got the One Love card and the check.
When it comes to banking, One United Bank is where I want to be.
Welcome back to Black Health. We are diving into the truth about our heart health with Dr. Heather Johnson. Dr. Johnson, please continue. I think you were mid-sentence.
Yeah, so we were just talking about as far as various numbers, from knowing our cholesterol numbers, blood pressure, and blood sugar numbers. I also talk about the importance of us understanding our family history and sharing it with the clinical team, because sometimes it's important for us to have what's called an EKG or ECG to look if there are changes related to high blood pressure or some symptoms that we may be having. I also say share everything that we can as far as what we may be experiencing. Sometimes we may not realize it's associated with the heart or a heart condition. The other thing, too, is that there's a very special cholesterol number called a lipoprotein A. So it's lipoprotein little a or LPA. And you may have begun to hear about it on the news and in the community. We've known about it in the medical field for a number of years. However, it's a special cholesterol particle that is genetically determined as far as whether or not we have a high level or a normal level. I tell people by the age of 5, your body has already decided if you're going to have a high level or a normal level. This is a very, very important cholesterol molecule because it by itself can be associated with an increased risk of heart events in communities. And individuals as far as from African ancestry, and especially as far as when we talk about race and ethnicities across even globally, we can see high levels as far as different race and ethnicities. So it's important to understand what your lipoprotein A level is. We only check it once now. That's it, just once, because it's helping us understand who may benefit from some of the newer medications that'll be coming down the line that will address a very important genetic cause of heart disease. So a lot of times we say check lipoprotein A, and if it's high, it's all the more reason to make sure all your other cholesterol numbers look good. For someone who does not have a history of heart disease, and especially over the age of 40, One of the things that we're also being discussed or recommended is what's called a coronary artery calcium scan. So it's a CAT scan. It's not an MRI. People always say, do I have to go through the long tube? And the answer is no. It's a CAT scan. And so basically there's no contrast, no needles, and it's lower radiation. But it looks directly in our body to see, do we have hardened plaque in our arteries? And so that's very important because I call it's a window. It allows us to see what's going on in our body. Maybe you've had a family history of heart disease. Maybe you've had other conditions, but that's a great way to see what's happening. Also, lastly, if you've had a history of high blood pressure, diabetes, a heart ultrasound or echocardiogram can be important to see how is your heart muscle doing? Is it squeezing well? Is it changing? Are there some things that need to be looked at, including your heart valves? So all of these things come together. The key thing is making sure your care is individualized based upon your risk.
Awesome. Dr. Johnson, we do have to come to the end of our show now. Just give our audience one thing that they can do to prevent heart disease. What is the one thing that you would recommend, or the top thing? Obviously, there are many.
Top thing, please have a heart checkup, know your numbers, combine lifestyle, and if needed, please take any recommended medication.
And where can they find you if they want to come and see you?
So our number is 561-955-2131 is the phone number to the Lynn Women's Health and Wellness Preventive Cardiology Clinic.
Awesome. Thank you so much, Dr. Johnson, for coming on today. You are a wealth of knowledge. Thank you for your passion and your heart, pun intended.
Thank you.
For what you do. And thank you for those of you that are watching. Thank you for watching Black Health. You can follow me at the Black Health Show on IG. And until next time, know that you are the healer you have been waiting for. Take care, everybody.
Our platforms are print,